We all have different parenting styles, and these differences can increase family tensions. Building a team approach between parents can help to minimize the stress that comes from living with diabetes.
It's like, can you do Catherine this morning? Because
well, sure I can. Would you like me to? Yes, I will.
It's that kind of thing. Like, then I get to sleep maybe an extra 10 minutes sometimes, but he needs it too, so it's kind of like that.
I'm probably not quite as good as exact measuring for his food. I might round off a little bit, whereas Lisa will be very specific and exact with both food and insulin dosages. So I get corrected occasionally for my judgment, but I accept that.
I think it's more important to understand that each person is different, and you have to accept the way that they want to deal with their diabetes. You have to be there, willing to help them improve in their treatment of diabetes, but you can't do it for them. You can't try to run their life.
When diabetes becomes the focus, brothers and sisters have a tendency to get overlooked. A sibling might start acting out in subtle ways, or even experience feelings of guilt for resenting the amount of attention their sister or brother is receiving. Acknowledging these feelings and encouraging them to be more involved can keep siblings from feeling left out.
I have probably gotten a lot more attention than the other kids. Some of it negative, some of it attention I just don't want, because it gets really old when your parents are following you around going, you look a little pale. Is your blood sugar low? It's like, no, I'm pale because we're Scottish.
I used to feel like I was given less attention than Chrissy was sometimes, but it just seems like less of an issue now, and, I understand that she has some special needs, and I just, I'm okay with that now.
I do remember, however, that we went to a family camp, family diabetes camp, and they had a separate session for the siblings, and Nathan and Daniel went. And afterwards, Nathan shared with me some of the things that he had said, and I felt horribly guilty, like I had neglected him and had not given him the correct attention that he needed. But then a couple of years later, I mentioned it to him, and he had forgotten all about it. So well, he had said things like, well, I resent it when Chrissy is eating things that make her go high, and so then it disrupts the balance of the family, or when she's not being particularly careful, and so suddenly we all have to focus on her to fix the problem, and he resented that.
We often tend to blame high or low sugars for our child's negative behaviors. But we need to keep in mind that a child with diabetes is a child first, and some negative behaviors may just have to do with being a kid.
When my sugars are out of range, I can get really nasty and tired sometimes, and my brothers would run away from me when I'm low. They're like, run for the hills, because I get really nasty.
And a lot of times when we can't figure out why she's behaving the way she is, we'll test her blood first, which really irritates her a great deal, but a lot of times it explains why she's not reacting the way we would expect her to react in certain things. It's just because her sugars are out of.
But we also have to hold on to the fact that she is a child, so that every emotion that she displays isn't because of the diabetes. So you got to run that balance. Okay, she's acting mad. Is it because something happened at school? Is it because she has a low sugar, or is it she's just having a normal kid day?
So at least it's one thing you can do is you can take one thing off the playing field. If it's not the diabetes, you can at least work to the next thing. And if it is, then you can correct that, and hopefully the attitude goes away too. Sometimes.
I remember when Chrissy was very young, and her blood sugar sometimes would be suddenly high, and I would have to try and figure out what did we do that made this blood sugar go high, and I couldn't find a reason why it had gone high, and I'd say, now I need to remember this, because when she's an adolescent, she is going to have those days where she's not going to know what exactly she has done that has made her blood sugar go high, and I need to be patient and understand that there are times when no matter how hard you try, you don't always do as well as you'd like to do.
And don't forget, you don't have to be the only support for your child. When you need a break, there are islands of safety with people eager to help you, such as neighbors, extended family, support groups, diabetes camps, and of course your diabetes care team.
Diabetes can trick us every day. You know, you can eat the same thing, have the same activity level that you did the day before, and the results will be totally different. So just when you think you're getting it figured out, things change. So we try and find a happy medium, knowing that as long as you're both doing the best you can, you do the best for that day, and then you wake up fresh the next day and you start again. And you don't beat yourself up for anything you've done, because that's probably the worst thing with diabetes, because then you feel bad and it's just a vicious cycle. So you put the day away and you start fresh, and you learn from each day.
Although diabetes isn't always easy to deal with, understanding and communicating our feelings as individuals can strengthen the family as a whole and help us to stay in balance.